Ashley?
Mm-hmm.
Hey, I'm Hillary.
Hey.
One of the practitioners here. So you're here for a well visit, right?
Yes, I am.
Okay. And you've never been here before?
No, I haven't.
Okay. We have a long list of questions to ask you, some of which are going to get personal, but like I said, this is being a patient, then we have to kind of get to the nitty gritty and ask them the personal questions, okay?
Sure, not a problem.
Okay. If you ever get uncomfortable, just let me know, okay?
Okay. I will.
Were you born in Athens?
No, I was not born here. I am from Georgia, from Southwest Georgia originally.
Okay. How old are you?
I'm 32.
Any allergies?
I do not have any drug allergies or food allergies. I do have severe seasonal allergies, especially in the spring.
Any winter or fall allergies?
Occasionally, just depending.
Okay. What do you do for a living?
I'm actually a registered nurse, and I work currently with hospice.
Oh, okay.
On-call nurse with hospice.
You work full time?
I do. Mm-hmm.
Are you married?
I am married.
Okay. How long have you been married?
About 7 years. My partner and I, she's female, so
Okay.
we are, I guess we've been together now, officially married for 2 years, but we've been together for 7.
Okay. Any exercise habits?
I do try to exercise 2 to 3 times a week, just depending. Sometimes that I get busy and things happen, but that's my regular attempt, I guess.
Okay. Any diet regimen that you adhere to?
I just try to basically eat healthy, take a multivitamin daily, try to do smoothies when I can, make it a little healthier that way, but nothing specific.
Okay. Do you smoke?
No, I do not.
Do you drink alcohol?
I do.
Okay. What do you drink?
I usually have 1 to 2 glasses of red wine every evening.
Okay. Okay. No illicit drug use in the past of any kind?
No.
Okay. Any surgical history or medical history I need to know about?
The only surgery I've had, I had my wisdom tooth removed, or teeth removed when I was young, about 8 or 9, and then I just recently got diagnosed with psoriatic arthritis. So I do see a rheumatologist, and I'm on medication for that.
Okay. What kind of medications do you take daily?
Well, I take Emerald injections, 50 milligrams weekly for the arthritis, along with Mobic daily.
Okay.
I take Flonase and Zyrtec D for my allergies, and then I'm also on a birth control pill called Gianvi that I take daily.
Okay. Anything for sleep?
Oh, yes. I take Ambien PRN for sleep, just when I'm not working, because I do have some insomnia related to the psoriatic arthritis.
Okay. Any problems staying asleep or getting to sleep?
Staying asleep.
Okay. What age did you start your first period?
I was 13.
Any problems with your periods?
A lot of problems. That's why I'm on birth control now. I was started on it at age 14 due to really painful menstrual cycles. So.
And it's helping?
It does. I have to stay on it permanently because of that.
Okay. Any unusual bleeding between your cycles?
I wouldn't say unusual. I do have some bleeding and cramping between cycles, but I've been told that's normal.
Okay. Are you and your partner sexually active?
We are.
Okay. How many times a week?
I'd say we try 1 to 2 times a week, just depending on how busy or stressed we are.
Okay. Any problems as far as that's concerned that we need to discuss?
No, nothing.
Okay. Any past pregnancies?
No past pregnancies.
Plans for future pregnancies?
Possibly in the next couple of years.
Okay. How old were you when you started having sex?
18.
Okay. Was it consensual sex?
Yes,
Okay.
yes it was.
Okay. How often do you get your mammograms and your pap smears?
I've never had a mammogram. It's not been indicated for me yet.
Okay.
But I get pap smears every year.
Okay.
And so it's about time to schedule that this year.
Okay. Do you get annual physicals?
I do. Especially since being diagnosed with the arthritis, I have to pretty much keep my blood work up to date every 6 months. So.
And when was the last time you had that?
I just had it last week.
Did you have a physical with it?
Not a specific physical. I think it's been about a year with my primary care physician. So.
Okay. About your mom and dad?
Mom and dad, They have high blood pressure and high cholesterol. They're still relatively healthy. I lost all my grandparents. I lost my grandmother on my mom's side to a cancer called pheochromocytoma in her early 50s, and my grandfather passed for dementia-related issues in his mid-70s. Then on my dad's side, lost my grandfather in his early 50s of a heart attack, and then my grandmother passed of, I think it was pneumonia. She had dementia as well. So.
Okay. Anything particularly concerning with you right now that you've been kind of in the back of your mind that you might want to see a doctor for, or anything that is?
No, since I'm already, getting my arthritis managed, that's the most important thing, I think, or the thing that's been on my mind, along with allergies. I might want to go see an ENT or allergist or whatnot to kind of look into other medications to manage my seasonal allergies.
Okay. Any stresses in your life that are kind of causing these insomnia attacks of any kind, or anything that?
Just the normal, basically. I think it started with psoriatic arthritis, just having uncontrolled pain and stiffness at night, but it has gotten better over the last 6 months, I would say.
Okay. So what we'll do now is we'll just move on with your physical exam here shortly, but if there's any questions that you have for me, feel free to ask me at any time during the exam, okay?
Okay.
All right.
Thank you very much.
You're welcome.